Do you want to hear a riddle? What is easily underestimated, deadly, and sends your world spinning? Is it the fear of death and oblivion? Is it high school crushes? Or is it the iceberg that hit the Titanic? If you thought about any of these, I'm here to tell you that you need help. You need to go to therapy because the answer to that riddle is surprisingly mundane. My name's Afik Kamarudin, and together on the Vital Sign podcast, we'll be tackling some of life's most overlooked bodily mysteries. And today, we're going to be uncovering the condition that's causing people to drop like flies. And I mean literally, they just drop. Because you see, falling is one of the leading causes of injury and injury related deaths among people of the golden age. And I'm talking about people over the age of 60. However, not every fall is due to elderly age alone. So today we want to unravel the mysteries behind this. So buckle in and get ready for a dizzying journey as we unpack everything to do with this head spinning, fall inducing condition called vertigo. On the show today, we have Dr. Gagan, who's a leading ENT specialist from UMMC, also known as University Malaya Medical Center. Right? Thank you so much for coming here and spending the time with us. This is going to be a dizzying path. It's going to be a dizzying conversation. And I'm glad that you're here with us to explore this topic a little bit.
Thank you for having me.
No problem, no problem. So to start this off, I want to talk about this feeling that a lot of people describe as dizziness. It's number one is disorienting.
Yep.
I know this because I have felt it before. I know so many people who have felt it before. I've even had people tell me it feels like they're losing balance and they're falling over. What I want to ask you is, what's happening in our body when this dizziness occurs or this feeling of falling over comes about? What's actually happening inside?
So actually, you're right. Dizziness is a very common complaint.
Mm-hmm.
A lot of people come to us with a complaint of, "Oh, doctor, I feel dizzy," or "Doctor, saya pening kepala." But actually, what we realize is actually it's just a symptom, dizziness. And dizziness can mean a lot of things. So the first job as a practitioner for me is to find out exactly what the patient is experiencing. And when you talk about dizziness from the medical perspective, we have a few divisions of trying to ascertain what the patient has. And one of the common things that patient who presents with dizziness, what they are experiencing is actually called presyncope.
Presyncope is a type of dizziness, or
Presyncope is a feeling where you feel like you want to faint,
Okay.
where you feel very unsteady. You may start seeing stars. You might see stars, and you might feel like you're about to fall down. But the patient does not know the word presyncope.
Yes, they're not going to come in and go like, "Doc, I have presyncope."
Exactly. So what they're going to come and tell you is, "Doctor, I'm feeling dizzy."
Right.
So it's very important to ask the patient in his own words how he feels.
Okay.
So another form of dizziness is a thing called disequilibrium.
Okay.
Have you heard of disequilibrium?
I know the word equilibrium and I know what this means. So when you put together, it just means
Absolutely.
lack of balance.
So equilibrium is balance.
Yes.
And when you have disequilibrium, it's a sensation of feeling imbalance.
Yeah.
It's sort of feeling like you're on a boat with very choppy waters. So, the waves are rocking you when you're sort of moving from side to side. That's disequilibrium. But when the patient experiences this, he's going to come and tell you, "Doctor, I'm dizzy."
Yeah.
And the third thing that is what we are really interested in as ENT practitioners is actual vertigo.
Okay.
So vertigo in itself is a symptom where things are moving when they're not. So most commonly in vertigo, things tend to be spinning around you. So you're sitting in a room and everything sort of moves, the lights, the tables, the chairs. But sometimes you can feel like you are moving around the room. And that is actually the experience of true vertigo. But the patient will come and tell you, "I'm dizzy."
I'm dizzy. So I want to bring it back to something you said about presyncope and this equilibrium, because I think for a lot of people, understanding the specific differences between in presyncope, it's a feeling of you're about to fall over.
Yep.
In disequilibrium is a loss of balance.
Yeah. Swaying. You feel like you're swaying on a boat. Yeah.
Okay. So what is the specific difference between feeling like falling over and feeling like you're swaying
So when you feel like you're falling over, you feel your legs are about to give way, you feel like you're about to tilt over forwards, you may start seeing stars, and you may be experiencing blackouts as well. Whereas in disequilibrium, it's just a general sensation of imbalance where you want to walk, you feel like you're staggering. And vertigo is a very, very different feeling where it's totally disorientating because everything is moving around. Yeah.
So what I'm understanding from this is in normal everyday life, when you're not feeling um, a lack of balance or you're not feeling like you're falling over, your body's working to maintain some sort of balance.
Oh yes, absolutely. So
Yeah, what does the body do to maintain that sort of balance?
So it's an integrated system, really. It starts from the brain, your spinal cord, your eyes, and a portion of your inner ear. So the ear is very important. Everyone thinks it's just for listening to music and listening to gossip, but there's also a specific component in the inner ear called the vestibular system. And that system, just like the internet, it works with various networks in the spinal cord, with the eyes and the brain, to maintain your balance and proprioception and orientation at all times. So that's the main role of the inner ear, one of the components. So every time you turn, for example, there's fluid in these tubes in our inner ears. As you turn your head, the fluid moves in a smooth manner to the other side, and that tells you that your head is actually rotating, and it keeps you in balance.
It's when there is a disconnect
between any of the sensory modalities. So the spinal cord is a sensory modality, the eye is a sensory modality, and the vestibular system is a sensory modality. When there's any sort of imbalance or disconcord between this, then the brain will sense that something is not right. And when you get two different inputs, everything goes haywire.
Among the patients that you see, among the ones who come in and they complain of dizziness, how many of them actually come in and say, I've got vertigo? Okay, so between the three terms that you mentioned, vertigo is, of course, the most widely known term.
Yeah.
I think a lot of people say, oh, I feel like I have vertigo.
True.
Out of the many patients that come and see you, how many of them actually say they have vertigo and it's accurate to the actual diagnosis?
So that's a very good point, right? We've got a lot of patients who have vertigo and they come and tell us they're dizzy. And there are patients who are actually having disequilibrium or presyncope who come and tell us they have vertigo. So what we do know is about 6.6%, there was a study published recently, only 6.6% of people in Selangor actually can know the difference between dizziness and vertigo. So that's very, very few number. 5% or 6% is very low. So a lot of people confuse these two terms.
The other thing that I've realized as well, that a lot of people are, I wouldn't say they're questioning it, but it's more of when they do self-diagnosis at home, it's between, is this a condition that I'm feeling or is this a symptom of something more? And most of the time when people self-diagnose, they go on stuff like WebMD.
Yeah, of course. And Google.
Yeah, they Google, which is the worst thing to do, by the way. I once Googled something and told me I was going to die. I said this in the first series as well, actually. But when people go through this period of self-diagnosis, the only thing I can deduce from it is it's because they either think it's a condition or they think it's a symptom.
Okay.
So I just want to clarify with vertigo, right? With dizziness that's attached to vertigo, is it a condition or is it a symptom of something worse?
So, very good point. Vertigo is actually not a diagnosis. Vertigo is actually a symptom. It's just like chest pain. If someone has chest pain, it could be due to various factors. It could be a heart attack, it could be a collection of fluid around your heart, it could be multiple things. So the same thing with vertigo. When someone tells you they have vertigo, it's not a diagnosis. It's not like, oh, you got vertigo, take tablets and carry on.
Right.
No. You need to find out what is actually causing this problem for the patient to have this symptom.
Okay.
And that's what, as a doctor or practitioner, you need to establish why is the patient having vertigo. And we know that vertigo has a few different causes, and we'll talk about that as we go on.
I understand that there are different levels of vertigo,
Okay.
but I also feel like you're going to tell me that there's actually different types of vertigo.
Yeah, well, levels would be described in terms of severity of
Right.
vertigo. So some people with mild vertigo, they can actually carry on with daily activities. Some people are completely bedridden; they won't get out of bed. But when it comes to the causes of vertigo, like I said, it's a symptom. So you need to find out what exactly is the cause. Now, the causes can be divided into peripheral causes, which is not really to do with the central nervous system. And that's the vast majority of patients who have vertigo. They come from peripheral causes, about 80%. And then 20%, which is the most serious one, are central causes. So things with relation to your brain, in relation to your heart and your blood pressure.
If vertigo is a symptom, in most cases, what is it a symptom of? Because I think this is an important question, because I know a lot of people go through what feels like vertigo. And knowing today that it's actually a symptom of something worse, what could possibly come from having vertigo? What are the things that might happen to you?
So really it depends. When you have a peripheral cause, most of the peripheral causes of vertigo are not life-threatening.
Okay.
There are very, very few peripheral causes of vertigo that is life-threatening. Central vertigo, on the other hand, can be very acutely life-threatening, or at least cause you severe morbidity. Generally, peripheral vertigo tends to be short-lasting. It doesn't last very long. There is a mild overlap, but generally central causes last for hours, days, and it doesn't sort of subside. Peripheral causes, because of compensation of the vestibular system, you sort of recover fairly quickly. But there is a mild overlap. There are some peripheral causes of vertigo that tend to last for hours to days. So that's one of the few differences when you have vertigo, and sort of, especially if it's the first time, you got to be really concerned. If you've had vertigo before and it sort of subsides after a few hours, it's not so worrisome as compared to vertigo that's lasting hours or days.
Is it very common?
Vertigo is pretty common. I would say about 60% of people with any sort of balance disorders will have some element of vertigo. We do know that in America, 20% of people have vertigo at some point in their life. So if you know 5 people, one of them is going to experience vertigo at some point.
So, Dr. Gagan, for a lot of people, right, including myself, we self-diagnose. It's something that you can't run away from.
Yeah, everyone does. Yeah.
Everyone does. Like when I feel something, I tell you, when I feel something, the first thing I do is go Google something.
Yeah.
I Google like woke up with a massive headache. Most of the time, they're gonna tell me I either have cancer
Or a bleed in your brain.
or bleed in my brain. I'm gonna die in like 5 minutes. But I also feel like the reason people self-diagnose is they wanna, the number one, they wanna know what it is that they're going through, what it is that they're feeling, because going to the doctor and finding the answer for what you're feeling is somehow scarier than Google telling you what it is.
Yeah, that's true. Of course, whenever you have a symptom, you're always going to think of the worst case scenario. And then you're going to call a friend or an aunt. Okay, so once we call people when we have this symptom, what we are relying on is their anecdotal evidence or their anecdotal experiences with what they had with vertigo. And they will tell you, oh, my grandmother's friend 6 weeks ago had vertigo, took some tablets and medication, and they resolved. But actually, what we do know is, although 80% of the causes of vertigo are peripheral and are not so dangerous, there are 20% of causes of vertigo which are central in nature. And when I mean central, I mean it's something to do with your brain or your heart. And those things cannot be ignored.
Yeah.
So the advice is, if you're having vertigo, you're not sure what it is, we need to establish a diagnosis first. And the best way to do it is to meet a medical health practitioner.
I just want to bring it back to when you were talking about peripheral and central. These terms, I feel, they don't carry meaning for people who don't understand what it is, right? Can I have you help explain what peripheral means?
Okay. Well, if you just take the word for it, so peripheral means something on the outside.
Yeah.
And if you're talking about central, then it's what's really at the center or the core of everything. So when we talk about central, we're talking about the brain and the spinal cord, mainly the brain. And when we're talking about peripheral, we're talking about the vestibular system, mainly. Of course, the eyes and the spine maintain balance as well. But in the general term, 80% of the causes of vertigo being peripheral would mean that it's most of the time coming from the inputs of the ear. And the inputs come from all sorts of places, and the brain is supposed to manage the input. And what happens is, if there's a disconcordance between what the ear is feeling and what the brain is sensing, then you get this sense of imbalance and vertigo. And classically, what happens is the ear is telling you one thing, but the brain and the eyes are saying we're not moving. And when there is the disconcordance, that's when everything starts spinning and you start seeing the world go around.
And you said 80% of the cases in vertigo are peripheral, and 20% are central.
Yes, that's true.
Is it safe to say that central vertigo is more serious? Is it a case of one is more serious than the other, or is it just a different sort of diagnosis?
I think you can't call it an absolute rule because there are some causes of central vertigo which is not very serious. But as a general rule, you would say yes, a vast majority of peripheral vertigo is not as serious as central vertigo. So when someone has central vertigo, then the consequences of that would be things like strokes, infections,
Oh my
cardiac
God.
problems. Whereas with peripheral vertigo, it's more things which can be managed with exercises and medication, things like that.
So we clarified that vertigo is a symptom.
Yep.
And then my question to you was, what is it a symptom of? And that's what you say. So if it's central vertigo, it's more linked to things like a stroke.
Yep, things that are
So
going on in your
brain-related.
central processing unit. Yep. Your
And then
brain.
if it's peripheral, it's more. So what was it again? It was
Your inner ear. So your balance system in your inner ear, those are the peripheral side of your balance system. And so if you're having a peripheral cause of vertigo, it's something to do with your inner ear, which doesn't mean that it's not serious. It can be serious, but it's definitely much less serious than if you're having an acute stroke. Because if you're having a peripheral cause of vertigo, BPPV, for example, it's a common cause.
What does BPPV
BPPV
stand
stands
for?
for benign paroxysmal positional vertigo.
Okay.
It is
Sorry,
one of
I
them.
asked.
It's one of the more common causes of peripheral vertigo.
Okay.
It is not acutely life-threatening unless you're driving a car at high speed when you get an attack. Then, of course, the consequences can be fatal, right? But if you're talking about central causes, you could die of a stroke very quickly. But you can live with BPPV for a couple of weeks, although it may be debilitating. You may not be able to get out of bed, but you will not die from it. So that's why whenever someone experiences vertigo, the most important thing is to find out what's the cause. Not to listen to somebody, oh, my grandmother said you just take some tablets and roll over a few times, you'll be fine. That does not work
Yeah, go see a doctor.
Yeah, exactly. Go and see a doctor, get the diagnosis right.
Yeah, I think that's the thing. For a lot of people, I think once you start feeling unsure about what you're feeling, I think that's when you go see a doctor. So back to like the whole self-diagnosis thing, right? When I don't self-diagnose anymore. Scared the whatever out of me the last time I self-diagnosed. But on Google, when you type in stuff, you get other questions that people have asked. And one of the questions was, how bad does it have to be until I have to go see a doctor?
Okay.
I'm sure this is something that you talk about a lot.
Yeah. So again, when it comes to vertigo and when you should see a doctor, if you've never experienced vertigo before and you're having the first experience where things are all spinning around you, the first time ever, see a doctor. That's the first thing you should do. Now, if you're someone who has been diagnosed with, for example, one of the causes or one of the conditions of vertigo, and you've been under treatment for it, and you get these frequent attacks, but you've had it before, the symptoms are the same, it's not so worrisome. You may need to make an appointment to see a doctor. You may need to find out why you're getting this attack again. But the few things where you definitely need to see a doctor, if it's your first severe episode, if you've got hearing loss associated with the vertigo, if at any point you're not able to speak or articulate your words properly, that means you're slurring your speech, you're not able to move your arm or your leg, or your face starts drooping. Those are all things that are not commonly seen with peripheral vertigo.
I see.
And those are sort of things that you need to see a doctor fairly quickly.
Okay. So it's safe to assume then, right? Like if you've never had vertigo before and you felt it for the first time, you probably know something is not right.
Definitely.
Because it's gonna feel disconnected from what your everyday life is.
Absolutely.
And that is the exact moment you need to go see a doctor.
Yes. So having vertigo is an experience that I don't wish that upon anyone. But when you get it once, you will never forget that experience of things moving around you and you're completely not in control. And frequently, the symptom of vertigo, especially if it's peripheral, they tend to be associated with nausea and vomiting because there's this huge amount of input that's going on, and your brain is not really adapted to handling so much of input, and that happens, and you get a lot of nausea and vomiting as well. So it's not a nice experience. You will know when you're having vertigo.
Yeah, that's what I would assume. Vertigo itself is, correct me if I'm wrong, vertigo itself is not fatal.
No, vertigo in itself does not kill anyone.
Okay.
But the cause of the vertigo may kill someone. So if you're having a stroke, or if you're having, significant amount of cardiac issues, which causes you to have vertigo, that will kill you. If you're driving a car on the highway and you suddenly the road is going around you and you're in no longer control of your vehicle, that's going to kill you. The consequences of the vertigo will kill you. Yeah, absolutely.
We hear, at least I hear, a lot of people that I know who has mentioned that they've either been diagnosed with vertigo or they haven't been diagnosed, but they tell me what they're going through feels like vertigo. My question to you, Dr. Gagan, is how common is vertigo actually?
Well, it's a lot more common than we think. Symptoms of vertigo or dizziness, they make up, 1 in 5 presentations. So 1 in 5 people who go to a doctor will have
1 in 5.
some element of dizziness at some point in their life, right? And what we know is every year, 20% of people in this world will have some element of dizziness, right? Whether it's actually vertigo, whether it's presyncope, whether it's disequilibrium, it's a lot more common than you think. So if you know 5 people, there's a high statistical chance that 1 in 5 of them has got some balance issues at some point, right? And what we do know over years of working, people who are in the ages of 40 to 60 tend to start beginning to get these balance episodes and balance issues just in relation to, as we age, our vestibular system or our balance system, it starts to go into decline as well. So from time to time, these things can flare up, especially in that age group. And we do know that women are more likely to get dizzy spells or vertigo spells compared to men. But again, after the ages of 70, then that sort of evens itself out.
Yeah, that checks out. Because obviously I lived with my mom for a while, right? And and she's always complained about having a headache, and it's very common for her. But I think she's gotten it checked, and it wasn't anything serious. So I don't think it's vertigo, but I'm just echoing the statistics that you've just mentioned. I think it's very prevalent when you actually look at who it is that comes around and talks about dizziness and vertigo.
Yeah. And people who come in with vertigo, again, the main job is first of all to find out the diagnosis and to determine whether it's peripheral or central. Now, we have a study that's come up in Quantan recently that shows that 60% of people who come to you with some sort of balance complaint or dizzy complaint, 60% of them are actually peripheral in nature. So again, that highlights the importance of actually, once you've got the symptom, to find out the diagnosis. And that's really what's important.
We spoke a little bit about the different types of vertigo.
Yep.
Mainly peripheral vertigo and central vertigo. What I want to talk about now is one of the consequences for vertigo is falling. Am I right?
Yep. Very true.
Can we do sort of like a deep dive into the consequences of vertigo, specifically about falling? Does that lead to what the vertigo is a symptom of, or is that an isolated incident? Why is falling a significant consequence of vertigo?
So generally, falling is not not the cause of the vertigo, unless, of course, if the cause of the vertigo is a stroke, and eventually the brain says enough is enough, and you've ignored the vertigo for long enough time, and then because of the stroke you fall down. But the vast majority of the time, the people who fall with vertigo, it's because of that sense of imbalance. They just don't know where to put their foot. And as we know, people who are older tend to get it. And as we get older, our proprioception, which is our sense of where our feet are in terms of our body, that also goes down. So as you're someone older and if you get vertigo, and it can happen to someone who's young as well, it's totally disorientating. And then you fall down. And when you fall down, it all really depends on where you fall and how you fall. You could have a small bruise on your arm, or you could land on your head and have a huge bleed in your brain that, end up in a coma for 5 days if you don't lose your life. So that's very dangerous. The other thing that we see with older people is when they fall down, they get fractures of the hip, fractures of the leg, and they're bedbound for 6 weeks, 8 weeks, even months. And then secondary issues come in, lung infections and other sorts of bed sores and things like that. Apart from that, if you're a young person who's going to work, driving your car, you get an episode of vertigo, you crash your car, now you've got no car. For how long it takes to repair cars in Malaysia. So without a car, you're stuck. Or if you have to miss work for a week or 2 weeks or 3 weeks, and your boss is calling you and say, when you're coming back, you pening, I pening, what are we going to do? So vertigo in itself, yes, it has a lot of consequences, in terms of falling, in terms of days off work, financial implications. So it's quite significant.
For someone who hasn't experienced vertigo, it's easy to say that you don't think you're going to lose balance.
Yep.
Because in everyday life, it's very rare as an adult, male or female, it's very rare that you actually lose balance. If you imagine, so we've explained the experience of vertigo as being everything around you moving, even though it's not, or it feels like you're moving, even though you're not. So if you just imagine what that feels like, you're not going to know what to step on.
Yep.
Moving forward is going to be a challenge.
Scary as well.
And it's scary. I can imagine. So if you just imagine that, when you start imagining things that way, I think it's easier to understand why falling over or losing balance is such a common result. It's not the cause, right?
Yep,
but it's
cause.
It's a result of having vertigo.
Yep, correct.
What are some of the things that is important to be aware of in vertigo? Specifically, how do people who have vertigo, how do they manage it?
So that's a very good question. It depends on, again, who they've spoken to.
Mm-hmm.
If they've spoken to your neighbor or the guy who sells them fish in the market who also has dizziness, then they're just going to ignore it. The fishman will say, look, I've been having dizziness, I can still drive my car to work.
Yeah.
But he may not be actually having true vertigo.
Yeah.
So when lay people speak to each other, they always say, saya pening kepala, you pening, then they will say, no, it's okay, I just took some vitamin C, I took extra tenggiri fish yesterday, and everything, resolved.
Yeah.
But really, from the scientific perspective, when you have vertigo or someone who has vertigo, it is very important to not just say, okay, you have vertigo, you're living with it, that's fine.
Yeah.
Right? So I'll share you a very important, very interesting case.
Yeah.
I had a friend who's a general practitioner. He's still my friend. I've not lost contact with him. And he was seeing this patient who was diagnosed with BPPV years ago. And from time to time, this patient would get these attacks of vertigo. But he just wasn't happy because most of the time with BPPV, when you treat the patient, 80-90% of the time they get better. And this particular patient kept coming back, to see him again and again. And he felt something was amiss. And he sent the patient to see me. And when I assessed the patient actually had focal neurologic signs. And
focal
neurologic signs.
Neurologic signs.
Focal neurologic signs is basically a sign that suggests that this is not a peripheral cause. You have a central cause. So he's not able to coordinate his hand to touch to a finger. He's not able to follow my finger with his eyes. He's not able to walk in a straight line.
And this is not just when he's going through an episode.
No, this is at all times.
Everyday life.
Everyday life. So he has these episodes of vertigo, but when you assess him properly, he actually has signs that suggest that something is not right with his central nervous system, with his brain. So I ordered an urgent MRI, got the patient admitted, and we found out that the patient was actually having a stroke, an evolving stroke at the time. Oh my God. Yeah. So vertigo is serious. If you do not have a diagnosis and you're experiencing vertigo, your number one job is to get a diagnosis first. Really, that's very important.
I think that's the point that we're trying to drive home.
Absolutely.
If you feel unsure, go get treated.
Yeah.
Is that why when you go see a doctor, so most of the time when you go see a doctor, right? Especially if you have a headache, one of the first few things they do is the eye thing, and that's to assess that particular thing.
So there are a few different eye tests. So one of the eye tests is to check for the movement of the eye.
Okay.
And the other one is to check the coordination of the eye with movement. So there are a few different tests that you can do when you're seeing a doctor. So again, a lot of people, when they go to see the doctor and the doctor does a test where they get the patient to follow the finger, and the patient walks out of the doctor's clinic thinking, oh, I've had my eyes tested. But in fact, he has not tested the acuity of your eyes, which means how clear you see things. He's not tested your vision, color vision of your eyes, nothing. He's just tested the movement of your eyes. So that's why sometimes a lot of people, when you ask them, have you had a particular test done, they may not be well informed. So one of the tests that we do for peripheral vertigo is to check the vestibulo-ocular reflex. And that includes moving the head to see whether the eyes can stay fixated to one point. But that's why it's so important to see a doctor. We spend a lot of time doing this.
You don't know what you're gonna have. You don't know you have to do that at home.
Yeah, you don't.
Like that?
Yeah. You got to fix your eye at one point, and you got to move your head right and left, and your eye should not move away from that point. That's assessment of your vestibular ocular reflex. So your balance centers with your eye, are they in concordance?
And the inability to do that points to...
Would suggest either a problem in the vestibular system or the ocular system. And then there are more further tests that we can do to
Right,
diagnose.
that's so interesting. So vertigo can be stroke.
Yep. It can be a symptom of a stroke.
Mm-hmm.
So it's very important when someone has vertigo, you need to actually find the diagnosis, like we mentioned. And we all know as we get older, we spoke earlier about it, between the ages of 40 to 60, predominantly in women, you get these episodes of imbalance and vertigo. But it can happen to anyone at any age. And that's what's important. You got to realize that even children have vertigo. And just because you're over the age of 65, it doesn't mean you cannot get vertigo.
Mm-hmm.
And I think that's the most important take-home message. You got to look out for subtle things, and especially our parents. You might realize there's a change in behavior from your mother or your father. And my friend was saying this to me recently. His father stopped playing golf. And, his father's about 72, 73 years old. He's, why have you stopped? And it's very good that the son actually picked it up.
Mm-hmm.
And when he asked his father about it, his father said, no, actually nowadays when I'm playing golf and I put my tee down, when I stand up, I just feel a sense of imbalance.
Because he bent over.
Yeah. So it's actually he stopped playing golf because he felt it was a bit unsafe. He felt a bit unsteady. And I think that's very important. When you start noticing subtle changes in your family, just ask them. If they actually have vertigo and it's a treatable cause, you'll be able to solve the problem. And his father had BPPV, and about 6 weeks later, he was back to playing golf.
Wow.
So for an older person, that was what he was looking forward to. And that's why the son picked it up. So it's very important to look out for people around you. If they have subtle changes in behavior, or they just mention, lately I've been feeling dizzy, just explore a bit into that. Because as you get older, you think that this is just part and parcel of growing old. Like, I'm losing my hair. And for me, it's part and parcel of growing old. And the same thing applies to dizziness and vertigo as well.
Okay, so I want to bring the conversation to the next segment, which is arguably one of my favorites. It's where we talk about myths. I'll bring up a myth.
Okay.
And then we'll have a chance to discuss it. You'll have a chance to elaborate on that myth.
Okay.
And then we'll conclude myth by myth so that people, at the end of this, people understand that the common belief is not the right belief.
Correct.
There's different angles to it. Different things to think about. So let's start with myth number 1. Are you ready, by the way?
Yeah. Ready.
Awesome. So myth number 1 is a lot of people believe that vertigo is equivalent to having a fear of heights. Is that true?
That's not true.
Mm-hmm.
The fear of heights is defined as agoraphobia.
Mm-hmm.
So basically, when you're at a high place, you get myriad symptoms. You may feel nauseous. You may feel like throwing up. And those symptoms are similar to vertigo in a way. But true vertigo is when things are moving when you're not. Okay. So generally, when someone has agoraphobia in a high place, what they feel is they feel that they are swaying. They feel like they may want to fall.
Mm-hmm.
They may get like a mini panic attack. Mm-hmm. They start sweating. They feel that their heart is beating really fast. But that's not true vertigo, And a lot of people, again, because we all come back to the same concept, saya pening, or I feel dizzy. Mm-hmm. So patients tell you, I feel dizzy when I'm up in heights. And that's where, as a practitioner, we always ask the patient, what do you exactly mean? And the patient will tell us, when I stand on heights, I feel like I'm going to fall down. That's not vertigo.
Right.
I feel like, I'm nauseous, I want to vomit. That's not vertigo. Although we know that vertigo can be accompanied by nausea and vomiting, but just being in a high place doesn't mean that it is vertigo if you're dizzy.
What about, can experiencing vertigo, if you already have an existing fear of heights, if you have vertigo as well, does that fear kick in?
No, because again, vertigo is a symptom. So it depends on what triggers the symptom, right? And most of the time in peripheral vertigo, there's a very common condition we spoke about called BPPV.
Right.
BPPV is normally triggered by sudden movements of the head or bending down. Mm-hmm. So if you're in a high place and you happen to turn your head very rapidly and you're having an episode of BPPV, yes, definitely you're going to have the experience of vertigo. Mm-hmm. But that can also happen in a swimming pool. That can also happen when you're on ground level. Right. So heights does not really affect it so much. Yeah, not so much.
Okay. Myth number 2 is those with vertigo should avoid exercising.
I wish that was true.
Yeah, me
Yeah.
too.
We don't have to exercise. Anytime they call you for exercise, say, no, I've got
Sorry, bro, I
vertigo.
got vertigo.
I can't go.
Unless it's golf.
Yeah, well, unfortunately, that's not true. Exercises actually have been shown to be quite beneficial for certain causes of vertigo. For example, BPPV. For example, certain conditions where your peripheral system has been insulted. And so, if you have an infection of your inner ear and your balance system, and that's quite common as well, some viruses can affect your inner ear, and then you have episodes of vertigo. And then by doing exercises which sort of fixate your eyes to a certain point, it teaches you how to get up from a sitting position, it teaches you how to move. These exercises are actually very beneficial in helping people live with conditions of peripheral vertigo.
Okay, so specific exercises.
Yeah, very specific. So there's hand-eye coordination exercises, there's walking exercises, stepping exercises. There's a lot of exercises that you can do.
Right. Myth number 3 is vertigo is only caused by medical conditions such as Meniere's disease. First of all, what is Meniere's disease?
Okay, so Meniere's disease is a condition where there's an excess buildup of fluid,
Right.
in the inner ear. So if you imagine the inner ear is a system of pipes with fluid inside, and the proposed theory of what happens in Meniere's disease is that there's a hydrops, or basically too much of pressure in that system, and that can cause you to have episodes where you have episodes of vertigo and also oral fullness, or you have reduced hearing in a particular ear. Now, that is a medical condition, and there are other medical conditions that can cause you to have vertigo, right? But you'll be surprised, even something as trivial as just knocking your head on, on the bedpost, for example, or anywhere. Trivial head trauma can cause you to have another form of vertigo called BPPV, where crystals in your ear are displaced. And any sudden movement of your head, you experience this vertigo. So a lot of people think, oh, doctor, I've got vertigo. Something's really wrong with me. It doesn't necessarily mean that way. It could be just something as trivial as BPPV.
Next myth, vertigo is untreatable, which means you just have to live with it.
Now that's a very common misconception. People over the age of 65 and 70, when they have these episodes of vertigo, they just come and tell me, doctor, I'm getting old. And I tell them, look, I'm getting old too, but it doesn't mean that if you have vertigo and, you have to live with it for the rest of your life.
Right.
So back to what we always talk about, what is the cause of the vertigo? And vast majority of time, peripheral vertigo can be treated. And even if there are certain conditions which are related to aging, for example, where there is no direct treatment, there is always compensation that's going to occur from the other vestibular system. So vertigo, especially peripheral, more often than not, it is treatable. You don't have to live with dizziness for the rest of your life, like the fishmonger.
Okay. Next myth number 5 is vertigo can get better if you don't move. That's a weird one.
It is true though. Some patients will come and tell you, they say, doctor, I've been having this spinning sensation, but if I just don't move and I close my eyes, everything is
better.
okay. But when I open my eyes, everything becomes worse.
So you just don't move forever.
Exactly. But again, it depends on the cause. So
Right.
if it's a peripheral cause of vertigo, what we do know is having optic fixation, which means that when you are having a vertigo that is because of your inner ear system, if you fix your eyes on a particular point, that vertigo will subside to a certain extent. Because, like I said, you need your eyes, your ears, your spine, and your brain. So by fixing one thing, whatever input is coming, you will reduce. So if you fix your eyes on something and the input that comes from your vestibular system keeps firing away, but your eyes are fixed, your vertigo will actually slightly get better. But if you're having vertigo because of a central cause, for example, if you're having a stroke, it doesn't matter whether your eyes are closed or whether your eyes are open or whether you're moving or whether you're not. The vertigo is not going to go away.
Because it's not causing by the.
It's not caused
it's
by
not
a
caused by the
peripheral
input.
system. So that's why it's hard to say whether this is a myth or it's true. But generally, vertigo, if it's caused by a peripheral system, if you fix your eyes on a certain point, it generally tends to subside a little bit. It won't go away entirely, but it helps.
Would it be useful if, let's say, you're experiencing vertigo, right? But of course you don't know whether it's peripheral or central. You don't even know these terms exist. But for people who are listening to this episode and then they're done with this episode. They go about their day, and then suddenly they feel something that feels like vertigo to them. Would it be useful for them to test it out by fixating their eyes on something, and if it doesn't work, um, then they might think it's something worse than peripheral vertigo?
Okay, so for career preservation, I'm going to be very careful what I say. If you have vertigo at any point in time, the first thing you got to do is stop whatever you're doing. Right?
Okay.
If you're driving a car, stop.
Stop on the
If
side
you're
of the road.
walking, stop, sit down. You can try optic fixation, which means looking at some particular point. But regardless if it goes away or not, if it's the first time you're experiencing vertigo, you need to see your medical practitioner because these things are very, very theoretical. It doesn't mean that if you have optic fixation and the vertigo goes away, it's definitely a peripheral cause. There is no hard and fast rule. It's sort of a generalized rule of thumb. But my advice again, first experience of vertigo, stop whatever you're doing. And then once things have subsided, and if it doesn't, just straight away go and see a doctor.
Awesome. We're down to our last myth, which is myth number 6. Vertigo is contagious / hereditary.
It is not. Vertigo, what we do know is there are certain types or certain conditions which can tend to run in families.
Right.
At the risk of sounding too scientific, we have small tumors in our vestibular system called acoustic neuromas, which in bilateral conditions can be sort of hereditary. But it's not always the rule. So you can have a family member who is more likely to have vertigo, but it can happen to someone with no family history whatsoever.
So I think it's important, and this may be common knowledge, but I think it's important to reiterate this. There is a difference between something being contagious and something being hereditary.
Absolutely.
Contagious, from my understanding, and correct me if I'm wrong, contagious means there is a spread of some sort of bacteria or some sort of virus.
True.
And vertigo is not caused by any sort of, unless it's an ear infection, is it?
Yep. If you have a ear infection that's caused by a virus, and that particular virus, instead of affecting your nose and your throat, which commonly it does anyway, but it has a special predilection to just go to the vestibular system, and sometimes not just the vestibular system, the hearing and the vestibular system. That term is called labyrinthitis. So you can't hear and you don't have balance. That's caused by a virus. But again, it's not a virus that is as contagious as COVID.
Right.
And it tends to affect susceptible people. So it doesn't mean that if you are affected with the virus and I'm affected with the same virus, that both of us definitely have to have vertigo.
Right.
It has a certain predilection and it depends on a host of factors. So it can be contagious.
So we've come to the end of the episode. And if there is one thing that you guys take away from this, and this is super, super important, so make sure you guys listen. Vertigo, as Dr. Gagan has said, is not a disease in and of itself. Vertigo is a symptom.
Yep.
Right?
Absolutely. You're right. And just to carry on from that, not every case of dizziness is vertigo. Not every patient who has vertigo is, they are going to have some form of dizziness. But the problem with dizziness, which we always say, is like dizziness is like calling everything that moves a car.
Yeah.
So a train is a car, a motorcycle is a car, a van is a car, a lorry is a car.
Yeah.
And that's what happens, So everything comes under this frame, dizziness. And vertigo may just be a parodoaxia.
Right.
So when someone comes to you with a symptom of dizziness, it's important to establish whether it's true vertigo or not. And in fact, if you're not sure, the best advice would be to see a medical practitioner, explain your symptoms, and once you've got your symptoms clear, the next step is to try to find your diagnosis.
Dr. Gagan, I want to thank you so much for spending the morning with us here.
You're welcome.
I think what we've done here is, I think we've done a service for the people. We've navigated a conversation that isn't necessarily taboo, but there are common beliefs that are incorrect.
Yeah, misconceptions. Really,
misconceptions, that's right. That's the word, misconceptions. And we've managed to explore that and help course correct people's belief systems as to what they're feeling. And of course, the two most important things is that vertigo in and of itself is not a disease, it's a symptom. And if you ever feel unsure, go and visit your doctor. Thank you so much, Dr. Gagan. I'll see you in the next episode.
Thank you for having me.
And I'll catch you guys in the next episode as well.
Bye-bye.
As we've stressed time and time again throughout this episode, vertigo is a symptom. But that doesn't stop vertigo from being heinously painful and absolutely soul crushing. You think I'm exaggerating because I'm not. Look at my poker face. But what if there were ways to alleviate the pain, even just by a little? Better yet, what if there were preventative strategies? All that and more on the next episode. I've been your host, Afik Kamarudin, and this has been the Vital Sign Podcast. This podcast is a production of Renegade Radio. It was produced by senior producer Kelvin Tay and producer Ragini Ravi. Written by Alisa Pong Lee Ann and Arnalden Brian Henry. Edited by Dixon Chia. And once again, I've been your host, Afik Kamarudin. Catch you next time on the Vital Sign Podcast.